According to the CDC in 2015, treating central line associated bloodstream infections have cost Americans approximately $32,254. Also, 100,000 deaths annually have been reported related to central line associated bloodstream infections. The use of chlorhexidine gluconate in the use of preventing bloodstream infections has decreased 61%. Research suggests that chlorhexidine gluconate wipes help in the prevention of central line associated bloodstream infections because chlorhexidine gluconate is an effective antiseptic that works against broad spectrum multi-resistant organisms such as MRSA and VRE, and it works by killing and preventing bacterial growth. Here on 2 South Oncology, we have high-risk patients due to using central lines and patients being immunocompromised related to their treatment of cancer with chemotherapy drugs. Right now, currently, the practice of documenting and giving chlorhexidine baths is not being done appropriately to meet our standards within the hospital. Audits show that 2 South Oncology has not been compliant with administrating their chlorhexidine gluconate baths in the daily bathing of patients with central lines on a consistent basis. The last audit showed that 2 South Oncology was only 85% compliant, and this is reported by one of our head educators, Colleen Zobel, in 2015. 2 South Oncology performs weekly audits by the charge nurse by selecting 5 patients that have central lines and go through their medical record to make sure that documentation is done on a daily basis. There are some barriers that have been recognized on giving chlorhexidine baths. One is there is a poor RN and nursing care partner ratio per patients. So there are times where, because short staff, that the baths are not getting completed. Another issue that is causing non-compliance is patients' refusal, especially during the evening hours. Patients don't like the idea of wipes, they prefer soap and water, and there's no specific chlorhexidine gluconate handoff between shifts. Secondly, education and support is needed for compliance to improve. This is also reported by Colleen Zobel, head educator on 2 South Oncology in 2015. Education will need to be provided to all nurses, care partners, and patients about documentation and compliance of the use of CHG. In order to do this, the nightly charge nurse will print out a list of central lines that are currently accessed on 2 South Oncology. Care partners will receive the list daily and will make sure that the baths are being provided and that the information is being documented in the doc flow sheet in the electronic record. Monthly reviews will be done and discussed at staff meetings. Patients will receive a handout on education of central line infections and how the use of CHG wipes relate to the prevention of CLABSIs. The 2 types of central lines that we use primarily on 2 South Oncology are implanted ports, which is a power port, which is implanted underneath the skin in your chest, and PICC lines, which are inserted through the arm, either left or right. In conclusion, chlorhexidine gluconate wipes help in the prevention of central line associated bloodstream infections because chlorhexidine gluconate is an effective antiseptic against a broad spectrum of multi-resistant organisms such as MRSA and VRE. 2 South Oncology has the opportunity to be 100% compliant with documenting CHG baths given to patients to lower the risk of CLABSIs. With proper follow-up by all involved, the risk of patients getting central line infections will decrease.